Hello, my name is Amanda Baynard and I am a DNP student at East Carolina University, and today I'm going to be talking a little bit about health information exchange and electronic health records. So it's difficult to explain what health information exchange is without first explaining what an electronic health record or EHR is. An EHR is an electronic version of a patient's chart. Patient information, including lab work, office notes, and hospitalizations, can all comprise a patient's electronic health record. Within an EHR, professionals from a variety of specialties, including providers, therapists, nursing staff, and other healthcare professionals, can see health information that's pertinent to their patients. Now that we know some basics about an electronic health record, it's time to define Health Information Exchange, or HIE abbreviated. HIE allows healthcare providers to securely access and share important patient health information with one another. The most common thing being shared via HIE are summaries of care for patients, from doctor's visits to inpatient visits. But shared information can range anywhere from small individual elements of care to full patient records. Information can be shared between providers in the same organization or between providers in different settings. For example, a specialty provider can request information from a patient's primary care provider regarding baseline labs and office notes or other information they may need. Consequently, a primary care provider can also request information from a specialty provider or an inpatient hospitalization visit so that they can provide the best care for their patients in the outpatient setting. Just as data can be requested, it can also be sent directly from provider to provider. And those providers who share the same electronic health record can oftentimes view information without requests at all. Federal legislation related to HIE includes the Health Information Technology for Economic and Clinical Health, or HITECH Act, of 2009. This act had the goal of accelerating and increasing adoption of HIE. The act offered providers financial incentives for achieving specific objectives related to meaningful use criteria. Incentives lessened for late adopters of the initiative and halted altogether after 2015. After then, penalties for non-adopters began accruing. To keep up with federal legislation, in 2015, the North Carolina General Assembly established the North Carolina Health Information Exchange Authority, or NCHIEA. They developed the North Carolina Health Connects, a state-level HIE program. North Carolina providers who receive state funds, i.e. Medicaid or state health plan, are required to connect to North Carolina Health Connects by 2019 in order to continue receiving payments from these organizations. Privately owned practices and organizations who do not receive state funds can opt to join Health Connects as well to share information. Barriers to implementation at the state and federal level includes competition between EHR vendors and the time it takes to implement EHR within an organization. An EHR must be in place before HIE can take place. Therefore, with delayed implementation time, HIE adoption is inevitably delayed itself. Some EHR vendors also block information sharing between organizations in an attempt to entice more organizations to adopt their EHR. With these barriers, there are some recommendations for adoption of healthcare information exchange in North Carolina. Since different organizations have varying EHRs that may or may not communicate with one another via health information exchange networks, giving patients the option to upload their own personal data to healthcare portals would improve communication between various networks. Patients could upload data from another visit, say a hospitalization, to the EHR at their primary care facility to ensure some continuity of care and that their providers are updated on everything that's been going on in their healthcare life. Another barrier to overcome is the cost of implementing EHR systems. EHR vendors often charge high fees for programs with increased HIE-related functionality. Mandating a statewide HIE vendor could help lower the cost and make HIE more attainable for independent, smaller practices. Health information exchange is an avenue to create more efficient and safer healthcare for patients. As more organizations and practices become connected to the HIE system, we can only hope to see improved outcomes for patients. Thank you.